So in cancer immunotherapy, there are a lot of proposed mechanisms of resistance, and those can be resistance caused by the cancer directly, but can also be sort of a dysfunction of the immune system. And a pathway that had been of a lot of interest to the field several years ago was the IDO pathway, but unfortunately I think was misunderstood, leading to a very high-profile negative phase 3 trial. When you go back, though, into the science surrounding that, it's very clear that IDO leads to a number of downstream events, and one of them that's seminal is the activation of a molecule called the aryl hydrocarbon receptor, AHR. And AHR has been known for a long time to do a lot of other things as well, other physiologic processes, but it's now been recognized that might be a much more potent way to go after driving immune responses. And so in the ongoing clinical trial that we presented a poster for, we have a direct inhibitor of AHR with the idea that this would be downstream of the previous targets that we've gone for and may have a much more direct immune activating effect. And so in the trial, it's a small molecule that's taken, and we hope therefore to drive and suppress the AHR and then come back and give an anti-PD-1 immunotherapy, because after we get sort of a percolating immune response, we then come back and hit it with anti-PD-1. And so I think it's sort of a next generation approach of trying to target resistance in patients with immunotherapy. And I think one of the big questions is which treatment for which patients, and trying to figure out which patients would optimally benefit from this approach. But this is early in the trial right now, and it's exciting to see where this will go.